Anterior, lateral, posterior. Your hip isn't subtle. Pain hits harder than student loans and lasts longer than your ex's drama. 27% over 45 years old have radiographic hip OA, but only 10% feel it. Imaging's just the receipts. Pain lives in the biopsychosocial environment, so focus on the disability. Altman's ACR hits 80% sensitivity, 70% specificity. If IR's less than 15 degrees and flexion less than 115 degrees, congrats, you've unlocked the OA badge. Sutlive's OA prediction cluster. Scour test, IR less than 25 degrees, pain with squat or extension. Slam 3 out of 5 and your rehab's now OA boot camp. Cut the gap. Femoral neck stress fracture, high risk in females, runners. Get that MRI. Before you rehab, check for landmines. Stress fractures, 10% of hip fractures are occult and common in female athletes or osteopenia populations. Posterior dislocations, think trauma, dashboard injuries, sports tackles or a fall. And if the leg's flexed, adducted and IR locked, you're not treating OA, you're calling ortho. Skip HLA-B27 blood marker unless you're chasing spondyloarthropathy or autoimmune causes like RA, but only if there's morning stiffness over 60 minutes, symmetrical involvement or other systemic red flags. Always ask about systemic flags, family history, and check if this is a simple rehab case or a refer now before you regret it case. Anterior hip pain? FAI is the top suspect, especially in young athletes. Hit that FADIR test, 94% sensitivity. If it clicks in flexion, adduction, and internal rotation, time to screen the labrum. Lateral, GTPS hits up to 25% in postmenopausal women. One leg stance test, familiar pain in under 30 seconds means 97% specificity. Posterior pain could be radic, deep gluteal, or SIJ ghosting the lumbar scene. Groin pain isn't one thing. The Doha agreement split it 5 ways. The adductor? Squeeze test is your go-to. Iliopsoas, Thomas test, inguinal, Valsalva, pubic, palpate, evidence, Weir et al., 2015. Suspect SIJ, the Laslett cluster's your rule-out hammer, 91% sensitivity. Distraction, thigh thrust, compression, sacral thrust. 3 positives, it's not your spine crying, it's that sneaky sacroiliac throwing shade. PROMs are your guessing. Who's for OA, Hagos for sporty types, PSFS when it's function-related, and Tampa when fear hijacks pain. First line, load. Second line, still loading. Manual mobility and don't sleep on balance. Rehab isn't babysitting the hip joint. It's rebuild or go home. Physio Logic out.